The next session is on new innovation and AI in interventional radiology. And the next speaker is Dr. Manish Swami, and he will give a talk on denervation therapies. Dr. Manish, please.
A very good afternoon to everyone gathered here, and thanks to the sponsors, organizers, and the moderators here for this opportunity. I'd like to keep this short because it's a big topic. I'd like to go on the key factors and give you a bird's eye view on renal denervation. So I'm Dr. Manish Swami. I come from Chennai, and I head IR team for Global and Bangalore as well. So I don't have any disclosure, no financial interest. To tell about drug-assisted hypertension, if a person is having a BP more than 140/90 despite appropriate lifestyle measures, plus a diuretic and 2 antihypertensive drugs belonging to different classes, then the patient is suffering from drug-assisted hypertension. And according to the US definition, a patient with controlled BP on more than 4 antihypertensive drugs are also considered as resistant hypertensive. So talking about the history of renal denervation, it started back in 1930s where they were doing a surgical sympathetic denervation known as Smith-Wick's procedure, and they used to do bilateral adenylectomy as well. The renal denervation procedures endovascularly has been done since 2007, where a few trials have come out, and 2014 after the third trial it was given up because of insignificant reduction in BP. So in 2021 though, there has been improved devices, better understanding of anatomical targets, and iterated trial designs. And now we are revisiting this procedure with very good outcomes. So this is a chart to show that many trials have been there where we assess the patient's adherence to medications, where most of the patients only 70% adhere to medications and 30% don't adhere to medications. So renal denervation modulates the afferent and efferent neural communication between the kidney and the brain, so that it stops the renin-angiotensin-aldosterone mechanism and reduces the hypertension of these patients. So the pathways between the brain and the kidney is cut off. So very important to see the anatomy here, because this is the change which has helped the new procedure to revisit the procedure, because the renal nerves often bypass the main renal artery and join in the branches, and 63% of the kidneys had renal nerves that join distal to the main artery. To see the cadaveric section, we see all the nerves from the sympathetic plexus are going beyond the bifurcation, and a few patients or many of the patients have an accessory renal artery which is also innervated by the renal nerves. So we have 3 different approaches to renal artery denervation, and which are under active investigation, including the use of radiofrequency, ultrasound, and injection of neurolytics into the renal perivascular tissue. So start with radiofrequency denervation. There are multiple sham control trials have demonstrated safe, significant, and sustained blood pressure reductions either in the presence or absence of antihypertension drugs. So here you see a catheter with the radiofrequency electrode over here, and there are a few electrodes which are causing giving out energies and ablating the nerves. So here I would like to mention about the spiral catheter, the Simplicity spiral catheter, which has multiple electrodes, and it's a multiple electrode catheter for circumferential simultaneous ablation in up to 4 electrodes. In the picture, you can see that we are going into the segmental arteries, and these electrodes are given pulses like 60-second radiofrequency energy is given, it's delivered through this catheter, and this electrode or this catheter can go inside a vessel almost 3 millimeter and maximum up to 8 millimeter in vessel diameter. And this is a non-occlusive catheter design as compared to the ones which I am going to show later. And the advantage of this is it goes through 6 Coming on to the rotational ultrasound system, so this is a catheter with a balloon around it at the tip with an ultrasound probe with it, and there is constant irrigation within this balloon, and the ultrasound probe emits ultrasound waves which causes ablation of the renal nerves. And if you see here, we keep this position in the main renal artery and we ablate the nerves. Like I said, this is all retrospective analysis of the procedures which were done earlier, and there has been two trials like the Radiance trial, Radiance HTN and the Solo, and Radiance Trial trials, which have shown that non-significant reduction in the blood pressure. Coming on to alcohol-mediated renervation or neurolysis. So there is a special catheter here called the peregrine catheter, which we use to put it inside the renal artery. And there are few microscopic needles which come out of this catheter, and we inject alcohol through these needles, and it causes chemical ablation of the renal nerves. So when we compare all the three procedures, we feel that the radio frequency is better because of the ablation zone which can be seen in the models. We can see that the electrode is causing good ablation around the artery, and in the histopathological slides we can see that this part of it is ablated around the artery. Coming on to the other trials like the Simplicity HT1, 1, 2 and 3 trials. The first trial had shown a significant reduction in blood pressure by around 26 millimeters, and the second trial showed about 32 millimeters. But the last trial showed that when it was a comparison with a sham control arm, the difference was only 3 millimeters. So that's why after 2014, the procedure was discontinued. However, when we look at why the procedure was discontinued, we found out that the renal nerves are innervating distal to the artery and not in the main renal artery or the ostium. So there are many trials which have happened in the previous years, like the Spiral and the Radiance trials, like I already mentioned, which compare between RFA ultrasound. And if you see that the reduction in blood pressure has only been less than 10 millimeter is the results. So, and as well, with respect to these studies, we see that there's not much of a significant complication in these procedures, except for pain in those procedures. And there was one unfortunate patient who died after the procedure. So, what is the outcome for renal denervation? So before 2014, renal denervation ablation was done only in the main renal artery up to the HTN3 trial. Now we have redesigned catheters, we have redesigned energy delivery system, energy modulation, we know how to do the trial, how to stabilize the medications, and we have information from the previous trials to show that the blood pressure can reduce up to 20 millimeter of mercury. So what is next? Now we have seen about the evolution of procedural techniques, we know the safety, we know the durability, we know the patient preference and patient related outcomes, and how it can influence on the clinical outcomes. So there are a few trials which are ongoing, and results are yet to come out, but the trials have finished and there are a few trials which are still going on. Over 6,600 patients have undergone renal denervation around the world with successful outcomes. And what we require right now is a prospective, international, multi-center, single-arm study to understand this novel evolving technique. So the criteria for considering renal denervation is a patient with persistent uncontrolled hypertension despite prescription of guideline-based therapy, confirmation of hypertension by ambulatory BP monitoring, home BP, because patient can always have a white-collar hypertension. We need to exclude other causes of hypertension, secondary causes of hypertension. We need an endorsement with other clinical colleagues like cardiologists, nephrologists, and internal medicine, because there are other significance like if a patient is having chronic kidney disease, what needs to be done, and diabetes mellitus, etc. So we need an experienced intervention specialist with appropriate imaging and wire catheter skills and equipment as well. So concluding, Renal denervation is supported by prospective power sham controlled randomized control trials. It is statistically significant and clinical relevant BP reduction is there. No major safety related issues are there with respect to this procedure. BP reductions following renal denervation persists throughout the day and night, and it's like an always on effect. And sentiment towards renal denervation shifting towards a third option in treatment algorithm will come in future after lifestyle change and medications. Thank you so much for listening, and welcome to Mahabalipuram in Chennai. This is from Tamil Nadu Pondicherry Isvir. Thank you so much.